Things pharmacists wish their patients knew. When people think about pharmacists, they often picture someone standing behind the counter, counting pills, and printing labels. But the reality is that pharmacists do so much more than that. We are medication experts, patient advocates, and play a vital part of your healthcare team. And if there's one thing we wish our patients knew, is that we're here to help in ways that you may not have realized. Hi, I'm Dr. Lisette, Overeat's pharmacist, and today I'm going to share some of the most important things pharmacists wish their patients knew. Stick around because these tips could save you time, money, and even improve your health. First things first, we are medication experts, not just pill counters. Pharmacists undergo years of rigorous education, typically completing a Doctor of Pharmacy or PharmD degree, which includes extensive coursework in pharmacology, medication interactions, and patient care. Many also complete postgraduate training or certifications in specialized areas such as women's health, chronic disease management, and medication therapy management, also known as MTM. We don't just dispense your medication, we ensure you're getting the right medication at the right dose in the right form and that it won't interact negatively with anything else that you're taking, including over the counter medications. Patients should feel empowered to proactively ask their pharmacist questions about their medications to ensure that they're fully understanding their prescriptions. Next up, guess what? Timing matters. Refill your prescriptions early. One of the most frustrating situations we encounter is that patients wait until the last minute to refill their prescriptions. Many medications, especially controlled substances or specialty drugs, will require doctor approval or prior authorizations or special ordering. If you wait until the day that you run out, there's a good chance you're going to experience a delay. So here's a pro tip. For most 30-day prescriptions, you can refill at least 5 to 6 days early. Controlled substances, they usually have maybe a 2 to 3-day window. It's going to be dependent on the store or company policy when it comes to fills. So plan ahead, especially before weekends and holidays. All right, here's a shocker to most. Insurance and pricing aren't up to us. One of the most frequent complaints we hear is, why isn't my insurance covering this? Or why is this medication so expensive? The truth is, pharmacists have no control over insurance formularies or drug pricing. Insurance companies decide what medications they will cover, how much they will reimburse, and which drugs require prior authorization. Here's a pro tip. Patients should ask their pharmacist about generic alternatives and potential cost savings. Many pharmacies offer programs for lower cost medications, and pharmacists can guide patients on how to find the most affordable options, including manufacturer coupons. Did you know that over the counter medications aren't always safe? Many people just assume that if a medication is available over the counter, it is must be completely safe. But that's not always the case. Many OTC medications interact with prescription drugs or have serious side effects, especially for patients with underlying health conditions like high blood pressure, diabetes, or kidney disease. Here's a pro tip. Always consult your pharmacist before taking a new OTC medication, herbal supplement, or vitamin, especially if you are on prescription meds. What everyone in healthcare wants you to know is that medication adherence is key to your health. Skipping doses, taking medications inconsistently, or stopping a medication without consulting your doctor or pharmacist can have serious health consequences. For example, missing birth control pills can lead to unintended pregnancies, while stopping antibiotics too soon can contribute to antibiotic resistance. Here's a pro tip. If you struggle with remembering to take your meds, try using a medication reminder app, setting a phone alarm, or asking your pharmacist about blister packaging or pill organizers. Guess what we can do? We can give vaccines, conduct health screenings, and so much more. Pharmacists are playing an increasingly expanded role in healthcare. They're providing services beyond just dispensing medication. Depending on your state, pharmacists can do any of the following. They can administer vaccinations, like flu, COVID 19, shingles, HPV, and many more. They can provide medication therapy management. They can perform health screenings for blood pressure, cholesterol, or diabetes. They can prescribe certain medications like birth control or even emergency contraception. They can help you quit smoking with nicotine replacement therapy. Here's a pro tip: patients who consolidate their prescriptions to just one pharmacy allow their pharmacists to have a complete picture of their medication regimen. This reduces the risk of harmful drug interactions and ensures better continuity of care. And here's the most important in my book: we are your advocates, not the enemy. We understand that dealing with medication issues can be frustrating. Insurance denials, long wait times, medication shortages, it's all very overwhelming. But we promise we're on your side. Pharmacists constantly advocate for their patients, whether it's by fighting with their insurance companies for coverage, catching doctors' prescription errors, or ensuring that you receive the safest and most effective medication possible. So here's a pro tip: the best patient care happens when pharmacists and doctors work together. Open communication between healthcare providers ensures patients receive the best treatment with minimal risk and maximum effectiveness. Trust your pharmacist. We're not just here to fill your scripts. We're here to ensure that you get the best possible care. Next time you pick up your medication, take a moment to ask us a question. You might be surprised at just how much we can help you. And if you liked what you heard today, let's continue the conversation. Do you have questions, or are you just simply curious about pharmacist services? Drop a comment below or just reach out. We'd love to hear from you. And don't forget to subscribe to our Substack channel for more expert insights on women's health, contraception, and medication management. Till next time.